So, good morning, examiners. My name is Hina Bhargava, and I'm going to be the principal treating physiotherapist for 28-year-old Maria, who had a motor vehicle accident 2 months ago. And from that accident, she sustained a fracture in her spine. According to her x-rays and medical reports, I got to know that she sustained a burst fracture of T11, and she's been diagnosed with complete paraplegia, spinal cord, at T11 level. In the hospital, she was managed conservatively, doing some medications, and after that she's been transferred to the rehab. It's been 4 weeks actually that she is currently doing her exercises with the physios and OT in the rehab. According to my patient's physiotherapy notes, I got to know that my patient is doing exercises with the physiotherapist, especially working on her transfers. With the occupational therapist, they are working on my patient's upper limb to get more and more strengthening in her upper torso. How my patient is managing everyday movement, I got to know that with the bed mobility, she is taking a help from one person, and for transfers from the wheelchair to the bed, she is doing it with the help of again one person, and she's using slide board transfers. Regarding my patient's past medical history and the medications, I haven't got any information, which I will explore that during my subjective assessment. Regarding my patient's living situation, I got to know that she's been living with a very supportive husband, and she's living in a farm, and the OTs have already been liaised to do some modifications in her house to accommodate her wheelchair and to be able to do household modifications in case she will have a smooth transition from the rehab to her house. That's all I gathered from my patient's medical file. So considering my patient age and the injury that she sustained, which is like complete paraplegia, spinal cord injury, I expect my patient to present with pain around in her spine or maybe in shoulder, because she's using her upper limbs quite a lot after the injury. I expect her to have weakness around the lumbar back area. I also expect her to have decreased movements. I'm also expecting her to have no sensation, no movements below T11 level. Regarding my patient's condition, I expect her that her mood levels will be quite low since she's very young and sustained that injury. So I'm just trying to motivate my patients throughout my assessment, and low mood could be one of my barriers. So I'll keep all these things in my mind. Regarding my patient's plan and exercises, though she is taking help from someone, I would like to explore that what are the problems and concerns she is facing at the moment. And my plan is to educate her how she can do some skin prevention techniques, how she can relieve her weight, offload some weight while she is sitting on a wheelchair quite a long time. And I would also like to be very much keen to educate her regarding how she can manage the muscle tightness around in her lower legs, and how she can inspect her skin throughout the day. So keeping all these things in mind, I'll plan my assessment, educate my patient thoroughly, and will give referral where needed.
Perfect. Excellent.
All right.
Very complete.
Sort of. All right. Okay. So what I will carry is, I will carry slide sheet. I'll carry a transfer board with me. I'll also carry 1 kg dumbbells, TheraBand. I will also carry a stopwatch with me, and yes, and I'll enter. All right. So.
Oh, okay. Okay.
I will do it.
No,
It's
no,
okay.
no.
Your phone is charging.
No,
It's okay.
I can do it.
You
Hold
sure?
on.
Okay. 15.
Okay, hold on. I just need to put the time watch here. So will be how many?
15.
15 minutes.
15.
Oh,
And then 5 minutes.
15 is done.
15 for subjective.
Yeah. All right.
So,
Okay.
Yeah, come in.
hello.
Hello.
Hi, Maria.
Hi.
Maria, my name is Hina, and I'm one of the physiotherapists here. How are you doing today?
It's okay.
All right, okay. So, Maria, I'm just going to give you an overview about today's session. I got to know some information from your file regarding your injury. I would like to know a bit more about how you're doing things at the moment in the rehab. Moving on, I'll be just checking strength movements, and if everything goes well, we'll do some exercises together. How does that sound to you?
That's okay, yeah.
All right, okay. So, Maria, could you please confirm your full name and date of birth, please?
Maria Smith, and I'm 28 years old.
All right, beautiful. Maria, are you comfortable at the moment?
Yes.
All right, okay. Can you just quickly check whether the brakes are on your wheelchair?
Yes.
All right, perfect. That's great. And Maria, just to assess me, how I'm going to perform, my assessors are going to be here throughout this session. Will that be all right to you?
Yeah.
Okay, good. All right. So Maria, I got to know from your file that 2 months ago you had an accident, and after that you have sustained some fractures in your spine. Is that correct?
Yes.
All right. And you've been doing some exercises with the physios in rehab. Is that correct?
We started, but I don't see any sense in all of it, to be honest.
Okay.
So.
Right.
Yeah.
So let's go back a little bit. So how much time did you spend in the hospital?
It was 1.5 months.
1.5 months. All
Around
right.
about 6 weeks, yes.
Okay.
I was just laying in bed all day,
All right. Okay.
and now I'm here, and I don't know what I should do here because, I'm sitting in this thing anyway, and I don't see any sense in all of it, so
Right.
just to let you know.
Okay. Right. So how are you feeling in terms of like are you feeling that you're getting a bit better or still the same or getting worse?
I haven't paid so much attention, I'm just sitting here. How can I get better when you rely on a wheelchair? It's just like, my life is over, seriously. Just put you in my position. I mean, your life is over. You could not do anything anymore.
Well, Maria, I completely understand about your condition at the moment. I can't even imagine myself in that situation, so I know how frustrating it is. But overall, if I see the good thing in that is that you are recovering really well from that injury, and you've been participating, doing exercises with the physio and OT. So I know that you've been thinking that your life is over, but what about just think that when you were admitted to hospital, there were so lines, so drips around you, and you've got a fracture. Your fracture is healed now, and now we have to think about how we can improve your quality of life from the upcoming sessions. All right?
Because in my perspectives, I do not recover at all, because there's nothing to recover. It won't recover. There's no cure. I will be sitting in a wheelchair for the rest of my life. I won't be able to walk anymore or do all the awesome things that I've done before. My life is over.
Have you discussed everything with your doctor or your neurologist?
Yes, they're aware that I'm quite depressed, and they gave me some drugs just
Okay.
to.
Did they tell you like how will be your recovery in the next few months or few?
Yeah, so it's gonna be rehab now. I mean, I work with OT as well, and we were already doing a home visit because I live on a farm and I do have horses.
Oh, that's
And
nice.
there's a river close by. I used to go kayaking a lot. I was a very active person, but now I'm just like feeling, how can I look after my horses, my whole farm, like with this kind of injury?
Yeah, it's quite worrying, isn't it?
It is completely worrying.
Lisa,
Excuse me.
okay. Well, Maria, first of all, I would like to thank you for opening up all these things with me. But so far, I can see that you're doing really well from the physiotherapy sessions. Like, when you had this injury, were you able to get up by yourself? How many people were helping you?
A lot of people.
A lot of people.
Yeah, especially in the beginning when I was in ICU.
Right.
There was like, I think, I don't know, 2 physios, 2 nurses. It's like so many people.
And what about now? I got to know that
Yeah.
only one person is helping you.
Yes.
So that means we are moving ahead, isn't it?
Yes.
I know. Sometimes it's really hard to go back and have a look what happened to you. And this can happen to anyone. Like, I can sustain that injury too. But whatever it's done, it's the past, and now we have to make a beginning, right? So I'm just going to ask you few things, and then we will be able to see what best we can do for you in today's session. All right?
Yes.
Okay. So Lisa, would you like to add anything to it? Like what sort of exercises you're doing with the physio at the moment?
I'm not very disciplined with the exercises, to be honest. We were
Alright.
doing we were trying some transfers when I struggled, and Like we did some dumbbell stuff, but I was
Mhm.
like, I don't know. But when you say it like this, I might try it today with
Okay.
you.
Do you feel tired while doing exercises?
No, it's okay. Like I mentioned, I was quite active
Mhm.
before, so I think I still have some strength remaining,
Mm-hmm.
especially in my upper body and my arms. I
Mhm,
just
mhm.
need to learn techniques how to do it.
All right, okay. Well, I'll just quickly ask you, what are your main concerns regarding your injury, or what is something that is bothering you at this
I'm
stage?
very, very, of course, frustrated, but I'm
Mhm.
also afraid to fall out of my wheelchair,
Okay.
especially when I go from the wheelchair to the bed.
Right.
Usually I'm just holding on to the nurse. I mean, I don't want to pull her down or anything like this, but it's
Mhm.
just like, I don't know,
Okay.
too stressful.
Okay, right. Whenever you're moving from the wheelchair to the bed, only one person is helping you at this stage,
Yes.
and they're using a transfer board. Is that correct?
Yes,
All right.
but it freaks me out.
Yeah, and you don't feel comfortable using it.
Mm-mm.
All right. Okay. So, are they putting the transfer board, or like you are just?
They did most
they
of
do
it,
it.
yes.
All right,
And then I'm
okay.
just holding on to the nurse, and we
Mhm.
try to go over there.
Alright.
So
Yeah, we can work on that in today's session
Mhm.
if that you feel like. Okay. Do you have any pain at the moment, Maria? Anywhere in
no,
your
it's
body?
okay.
Okay.
But the nurse has told me because when they helped me with toileting and everything, that I get some sore spots on my buttocks.
All right. Okay.
So that's not ideal, and I don't know what I could do because I
Yeah.
can only lay in bed or sit.
Yeah.
That's it.
Okay. But what we can do is we can teach you some pressure relieving techniques so that you can manage that. So when the nurses told you that you've got some sore spots, did they mention that any skins, like the skin is between broken, or it's just the redness around
It's
that?
just redness. I think
Redness.
just pressure sores. Yeah, just
Alright.
redness. Nothing open yet.
Okay.
Yet. So, like I said, it goes a little bit more this way
Mhm.
instead of.
All
I
right.
don't know.
Okay. Thanks for letting me know. Do you have any dizziness, nausea, feeling, or any
Oh, no,
headaches?
that's fine.
Okay, that's good. Whenever you're taking a shower, do you feel the difference between hot and cold on your arms?
Yes.
What about on your legs?
Nothing
No, all right.
yet.
Okay. Do you have any chest pain at all?
No,
Okay.
I was coughing a lot after when I was in hospital,
Yeah, yeah.
but now it cleared up. It
Oh, that's
seems to be fine.
All right. Do you do any breathing exercises, Maria?
I'm not very
No?
motivated to do
All
anything.
right. Okay. But all right. Have you talked to someone regarding that? Like, have you explained your situation to your? Are you living with your partner or your
Yes, my
husband?
husband.
All right.
Yes.
Have you like shared your feelings? So.
Oh, I don't know. He's avoiding to see me a lot. I mean, he's there and he's supportive. I think we still both have to process everything.
All right. Okay.
So he struggles too because he's so busy at a farm. You know, we have like horses and it's like a lot of work
Mhm,
to
mhm.
look after a big house like this, and it's
Ah.
just like
Okay. So how are you both coping with that?
nothing. We just leave it how it is. And,
All right.
yeah.
Okay. Did your physiotherapist or your occupational therapist did mention about something regarding social worker, like they can come and talk with you, they can assist and
Not yet. No.
not yet?
No.
All right, okay. With the occupational therapist, you're doing upper limb exercises, is that
Yes.
correct? And how you feel about that?
Yeah, it feels good, but I'm just like, I don't know. I don't feel that
Yeah,
motivated. to do
Motivated.
it.
All right, okay. You don't feel motivated. Is there any particular reason, or you just feel very low these days?
Just low
No? Do you feel tired at all, Maria?
all the time.
All the time? You just feel tired after doing something, or it's
No,
just
just
overall?
in general.
All right. Was it there
Very
before
depressed.
you had this?
No, I was
All right.
in the
Okay.
center of my life, in the best time of my life, and
Right.
now it just feels it's over.
All right. Okay. Like I said, that we can always look the positive side of it. Like every day, we are going to make slight, tiny bit of changes, and we can there to help you to recover better.
Yes,
All right.
yes.
Okay. So regarding your toileting and your showering, do you have any trouble like voiding water or like with your bowel? Any trouble?
This is as well a very thing that I don't like to talk about, but I don't have any control about it anymore.
Okay. Right. So how are you managing your bowels at the moment, or
I'm
Yeah.
just wearing a pad.
you're wearing a pad? All right. Okay.
Mm.
What
I
about?
think that's the reason why my husband is avoiding me as well.
Mhm.
It's very uncomfortable. I'm 28. Hello, I'm not 80.
Yeah. I understand. And it's quite normal for someone to sustain that injury to be able to do that. But do you feel any sensation around your private parts?
Mm.
Can you hold your urine or you don't have any control? Okay. Have you saw any nurse regarding that?
Yes, they do. They manage it all
Okay.
the time. I don't wear just a catheter anymore because now I'm in rehab.
All right.
So it's just a
Okay.
pad.
Right.
So when I need to go, it just goes into this.
Okay, right. And whenever you're doing showering and stuff, do you
Mhm.
are you able to help the nurses as well, like putting shower gel or
Oh
soap?
yeah, I can do that.
All right, that's
Yes.
good. Regarding your previous level of mobility, Maria, were you absolutely all right, active, very fit,
Mm.
doing exercises and everything?
Mm.
All right,
course.
okay.
Always on the go, always taking care of everything.
Yeah. All right, okay. And regarding your medical history, I haven't gathered any information. So would you like to share anything? Like any history of blood pressure, diabetes?
No,
Heart
not at all.
condition.
Very healthy.
All right, that's
Yes.
great. Good to know.
No drinking, no smoking.
Oh, that's good.
really.
All right. Have you had any falls while you were here in rehab or in hospital? Any missed trips or?
No, but I think like this going from here to
Mhm.
the bed,
Mhm.
it's complicated, I would call it.
Okay, we'll have a look what
Yes.
is the complication and maybe we can make it a bit easier for you.
Yes.
All right. And what medications you are taking at the moment, Maria? Do you have?
Antidepressants, I think they make me so tired all the time.
Do you feel very sleepy while taking that?
Yes.
Okay. Have you told your doctor about that you're sleeping?
Oh yes, they said that's just a normal common side effect. So for
Okay.
me, to be honest, I think I just have to go home and see my horses again.
Yeah.
I think and just be there. I mean, of course, I don't even know if I can go with a wheelchair to my horses again.
Yeah.
It's just so hard.
Have you discussed this thing with occupational therapists to do a little bit of modifications?
Yes, they're planning to do some
Excellent.
changes at our house.
Yeah,
I mean, it's
excellent.
gonna be super expensive, but I don't care. I just need to go to my
All right.
horses.
Did you talk about taking help from the government funding or like anything?
Yeah, my husband didn't care about that.
All right, okay. Now regarding your living situation, Maria, were you working before having this accident?
Yes.
So what was your profession?
I was working as a horse therapist.
Oh,
That's why we have the farm and the ranch.
All right. So were you working like it was like your self-employed business, or you're
Yes.
working under someone?
Yes.
Right. Do you have any financial constraints at the moment?
I haven't really thought about it. I was just like, I did not care. I did not
Okay.
care. It all asked my husband.
All right, that's okay.
Like, even whatever I needed a house, he can pay for it or whatever.
Okay.
I don't care.
Right, okay. And regarding your house, is it like a single-story house in a farm, or like can you
Yeah,
describe
double
it?
story house, very
Double story.
big, yeah,
And
very
your-
open.
Mhm.
So that's.
And your bedroom is upstairs.
Mhm.
All right. Have you got any steps? Obviously, yeah.
Yes. I
Alright.
think should be about 12 of them.
12
just to
of
go
them.
from the lower level. to
Yeah,
the
it will
upper
be a
level.
good idea if the OT can do modifications,
Yes.
especially nowadays we're getting lots and lots of equipment, you know.
Yes.
So
I was already talking where they get just like a little lift for me that brings me in my wheelchair up the stairs.
yeah,
So
yeah.
that I will be able to go there and do some modification in the bathroom to make everything accessible.
It
with
will
my
give you-
wheelchair.
Yeah, it will give you more control how you can manage things. All right, okay.
Yes.
Perfect. Any hobbies that you like doing?
Yeah, being with my horses and kayaking.
All right, okay. And is your husband like he works full time, part time?
Yeah, he's like we have this business together, so
Alright.
he's working at the moment.
Okay, all right. So Maria, I just wanted to share something. Like once you're back at home, initial few weeks are gonna be quite overwhelming for you. So in any case, if you feel that you need help with preparing your meals or cleaning your house, we do have some services available, and if you're happy, I can share that with
That
you.
sounds good. Yes.
All right, okay, great. Now, Maria, what would you like to achieve in today's session?
I would like to go safely from the wheelchair to the bed.
Okay, right, yeah. And what would you like to achieve in a couple of weeks?
To go home
Okay.
because this
Yeah.
rehab is very depressing as well.
Yeah, right, yeah. Okay, now Maria, I've just got a note of everything, and once I'm finished with my baseline assessment, we'll again come back and discuss.
Mhm.
All right? Okay, that's good.
Okay,
Okay,
but you're finished.
okay, thank you.
Uh-huh.
All right, okay. Now, Lisa, I can see that you can hear me really well through the conversation. Can you see me well as well?
Yes.
Okay, that's good. So first of all, I'm just going to quickly check how good your muscles are. All right. So what I would like you to do is just lift your arm all the way up, okay, and bring it down. Okay. Don't let me move you. Good, great. Can you bend your elbows and touch your shoulder? All right. Don't let me move you. Wow, that's good. Don't let me move you. Right. Can you push my hand away? Excellent. Push my hand away. Excellent. Can you squeeze my fingers as hard as you can? Excellent. Good work. All right. Now what I'm going to do is I'm just going to check how well you can feel my touch. Though you said that you can feel the difference between hot and cold. So I'm just going to stroke my finger on different parts of your hands. You have to close your eyes and tell me in which direction I'm stroking you, okay? Just say right and left.
Yes.
If that feels okay,
Yes.
just say it feels alright, okay?
Right.
Good?
Left.
Does that feel the same?
Right. Left.
Does that feel different? Okay.
Both together.
Okay. Does that feels alright?
Yes.
Okay, that's great. You can open up your eyes now.
Mhm.
Alright, that's great. Let's check how well you can perform some movements. So your muscles are quite strong. We'll see how well you can perform some movements. So Lisa, with your right hand, can you just tap it up and go? Okay. Alright, excellent. Good. Can you do it with your left hand? Alright, that's pretty good. Good work. Alright. So the next thing is I checked your strength. I would just like to check whether you have got any tightness in your legs. But I would like to check it on the bed.
Yes.
Alright. So the next step would be for us to use the transfer board and see how you're doing things at the moment. And then I'll just check some movements in your legs and then we'll do some exercises. How does that sound?
Yeah, sounds good.
Alright, that's good. So now, Lisa, what I'm going to do is I'm just going to move your wheelchair towards the bed. Alright, and then I'm going to remove the foot plate quickly. Alright, do you remove it by yourself or you need someone
I think
to
I could reach it if
Okay.
I wanted to, but I just
Fine.
let the nurse do everything.
Okay, right. And what about going out to the gym area or going out to the hallways? Do you normally propel your wheelchair by yourself?
I think I could, but I never do it.
Okay. Have you
Well, it's
tried
just-
doing that?
No, I was just in my room sitting here.
Alright, so like mostly you press the buzzer, nurses will come. Alright, okay, not a problem. So I'm just going to, can you remove the brakes for me?
Mm-hmm.
Excellent, good work. Now I'm just going to wheel you towards the bed like that.
Yeah.
Okay. So imagine this is the bed, Lisa.
Mm-hmm. Okay, it's right in front of us.
So, no, can you stand up for me? Sorry. So,
Mm-hmm.
this is going to be the bed
Mm-hmm.
and this is going to be the wheelchair.
Yes.
Like that. Alright, okay. Excellent. Alright, can you again put the brakes on for me? So this is the bed. Alright. Now, I'll be standing next to you, but can you try removing the foot plates for me? Alright. You can pass it on to me. Alright.
I don't know what kind of foot plate it is, if it's like one of these
Yeah.
or just like,
Yeah,
yes,
alright.
just to the
So
side, yeah.
this one, can you pass me your left one as well? Alright. Excellent. Good work. Alright. Now Maria, I can see that you're not taking help from the back, right? That's good. Can you cross your arms across your chest? Good. And see how long you can hold this position. So I can see that you're not taking help. That's good. Now can you look over your right? Okay. Look over your left. That's good. Alright. Are you doing any exercises for your tummy?
Not at the moment.
You can put your hands down. Yes.
Yeah.
Alright. Not a problem. Okay.
But I would like to do something I don't want to get fat while I'm sitting in here.
Okay,
So,
yeah.
Yeah.
Alright. We'll see.
Please give me something
Alright.
to do. Yes.
Yes. That's a good thing that you're asking about the exercises. Yeah. Alright. So the next step would be, Lisa, because we are doing it for the first time and I haven't seen you doing, I would like my assessor to be with us. So assessor, could you please come here? So I would like you to stand in the middle of the wheelchair and the bed. Alright. So we are going to help Lisa while moving her from the wheelchair to the bed and we are going to use a transfer board, okay? So what I'm going to do is, I'm just going to ask Lisa to move to one side, put the slide board on. Make sure that whenever she sit on a slide board, her trunk is aligned with the hip. If you see that she's a bit wobbly, you can just support her from the shoulder.
Okay.
Alright, and make sure that she doesn't sit too far from the board. Alright, that clear?
Mhm.
Alright. So Lisa, is that alright with you? Alright, so what I would like you to do is, just hold on to the armrest, alright, and lean towards that side. Can you see that your hips are up? Okay. I'm just going to put the transfer board. Alright. Now Lisa, you can lean back. Excellent. Alright, good. Now, we are going to move you from the wheelchair to the bed in 3 steps, okay? So the first step would be, I would like you to put your hand on the slide board. Make sure that you are not going to hold the board inside so that your fingers won't impinge, alright? So you're gonna propel yourself and sit in the middle, and then the next step would be sitting on the bed. Is that okay with you?
Yes.
Alright. And if we feel that you are a bit more unsteady or wobbly, we'll help you, okay? But I would like to see how much you can do it. Alright? Okay. Assessa, are you okay with that? Okay.
So just to hold her here, if she's not.
If she's a bit wobbly, or
Yeah.
if you can see that she's sitting too far from that board, just
So
let me
what I'm doing, what do I do now? Usually I hold on to the nurse and she just brings me over.
Okay, right. So she holds you, right? Okay, not a problem. So I'm just going to stand in the middle so that, all right, okay. Well, you can hold my hips if you want to. All right, okay, that's good. Now, we are going to lean, okay? Lean on one side, okay?
But I can't push with my legs.
Yes.
So I don't know what to do, sorry.
Okay, that's okay. What about you can put your hand up here,
Yes.
all right, and the other hand over there. On the count of ready, steady, move, just try to lift your bottom up and move up here. All right, and I'll give you a slide.
Yeah.
So, Lisa, just put your hand like that. All right, okay. Ready? Okay, so 1, 2, and 3.
Can I just
Great.
do it in little steps? I'm too afraid.
Okay. Well, you can see that my assessors are there, and I'm there at the front, so you're in good hands.
Yes.
All right.
Okay.
Keep your hand flat.
Yeah.
That's good. So ready, steady, move. All right. Okay. Thank you, assessor. All right, Lisa. I'm just going to put your leg like that. How did you feel about it?
That was okay.
That was okay.
I think I would like to do it like in little steps instead of one big thing. So.
We just took 3 steps, like from the wheelchair to the middle of the board, and then the next step towards the bed. I can see that you can push really well. It's just that we have to make this movement a bit more smoother.
Yes, I think I
Alright.
have the strength to lift myself up. So.
So Lisa, like you said that you've been doing exercises with the OT, but one session with an OT will not going to improve your strength. You need to do some homework by yourself, and homework means that you can do some exercises, take some break, and then do some exercises, because you're here in rehab. We really want you to recover. Okay,
Yes.
right. How about we practice this movement back and again?
Yeah,
And this time, I would like my assessor to be there, but we are not going to take help from him. Will that be all right to you?
Yes.
Okay. So next step would be, again, back from the bed to the wheelchair, and we'll practice, making you to do more often so that you can feel and have a better control how you can do it.
One more question. When I would be in bed, how do I get to lay down? Can you show me this as well?
Absolutely. Once we are getting a bit more comfortable and confident in that, I'm going to have you on the bed, and then we'll do the rest of the assessment.
Yes, because
Alright.
it would be so nice to do everything without
Yeah,
a nurse
absolutely.
at some stage.
Yeah, absolutely. We'll do that. All right.
Okay.
So, assessor, I would like you to again stand in between the wheelchair and the bed. All right. This time we are going to help Lisa to move from the bed to the wheelchair, getting her more confidence. So I would like you to not help us. Only if you feel that she's sitting too further on the slide board, then you can just help her.
Okay.
All right. We will keep an eye on that. All right. So Lisa, now what we are going to do is, I saw what is the problem in there. I would like you to get a little bit more momentum. Okay, so I'll show you on the chair. All right, so I'm sitting in a chair. When I'm moving my weight up here, the other hip is up. That means we are offloading on one side. and it will be easy for you to move from one place to another by getting the momentum. All right, so let's practice that. Again, do you know what you have to do? First
Yes.
step.
Yes. Put the slide board. Just like bring my hips
Yep.
up.
Hip
Put
up.
the slide board underneath.
That's good.
then
And
just-
making sure that the hip board is
Mm.
quite nice, so the surfaces that do not have any what do you call it?
Angle.
Any abrasions
Oh,
or
yes.
anything,
Mm.
because the skin is a bit more sensitive and we don't want you to have any cut. So have the transfer board, hold in your hand, just slightly check the edges. If that's all look good, move on one side, especially on your left side. Fit the board up here
Mhm.
so that you can feel that you're sitting nicely.
Okay.
All right.
Yes.
So we are going to move that in 3 steps.
Mhm.
One is here,
Mhm.
2 in the between, and the
Mhm.
third step would be on the bed.
Okay.
All right.
Yeah.
Are you okay?
Yes.
All right. Don't be afraid. We have
Yes.
covered you in 2 directions.
Sounds good.
All right. Okay. So I'm just going to help you a little bit with your legs. All right. Okay.
I think I could even position them on my own.
That's good. Excellent. Good work. Now, if you're feeling that your hands are getting more tired, you can even hook your leg if you feel like. All right. Let's do it together. So let's count. I
Mhm.
think so that will
Yes.
give you. Okay. So Lisa, just put your hand. Yep. Because we are moving in that direction. All right. Okay. Let's do it. So 1
Mhm.
and lift yourself. Excellent.
Mhm.
Good work. And then 3. All right. How did you feel about it?
Yeah, better.
I didn't help you this time.
Yes.
You did it by yourself.
Yes, and
Alright.
it feels like I actually use the strength of my arms.
Yeah, that's a good thing, isn't it? We call it overflow, like you're using your upper limb to be able to help you and to be able to do things by yourself. All right. Still,
Yes.
let's do one more time so that you will get more confidence in that.
So I'm leaning over, bringing the slide sheet underneath my buttocks and see that everything is okay there.
That's good.
Put my hand there. Not
Make sure that
quickly.
your elbows are locked
Yes.
because we don't want any strain on your elbow.
Yes.
Alright.
Okay, and then I just create a little momentum
Mm-hmm.
and just like push up and go
Yep.
to the middle first and then push up.
Alright.
And then
That's good.
reposition my
Good. Now, Lisa,
legs.
obviously you're sitting on a bed now. Thank you, examiner.
You.
I don't know what the heck this is the first time I'm doing it. Alright, okay. Right. So Lisa, in the next step would be, I would like you to lie down on the bed. Can you just show me how do you normally lie down on the bed?
Usually the nurse is doing it for
Alright.
me.
So can you tell me like how do they normally help you? Like
They
do they
just come from there, hold
Mhm.
my shoulders and bring my legs up.
alright, so just only one nurse is helping you or 2?
I think she is like not looking after her back very properly.
Oh, alright, okay. Maybe we can talk about that after the
I
session.
think so.
Alright, okay. Now Lisa, how about I want you to just slowly walk with your hands towards the bed this way. Alright, and once you are
With
in
my-
line,
With my body?
Yeah.
Okay.
okay. Yeah, that's
good.
good.
That's very
That's good.
slightly slippery.
That's good. And now I would like you to slowly lean onto the pillow and I'm going to help you with your legs. Alright, 1,
Uh-huh.
2 and 3.
Yeah.
You okay?
And now?
Alright, okay. Now, on the count of 1, 2 and 3, we are going to make you lie down on your back.
Oh yeah, I can roll myself.
Okay.
over. That's okay.
Alright, that's good.
Just like, yeah.
Alright, that's okay. Alright, are you okay now? Alright, so Lisa, you said that you want me to help you how you can lie down effectively. In order to move into that segment, I'll just quickly check whether you've got any tightness or not. Alright, so I'm just going to move your leg by myself, okay?
If I close my eyes, I would not even could tell if you do anything.
Mm-hmm. How long do you normally spend on a wheelchair in a day? Like, can you tell me your routine?
They just bring me out of the bed in the morning and bring me back to bed in the evening.
All right, so roughly you're spending 6 to 8
hours,
hours in a
yeah.
wheelchair.
Yeah.
Right. Well, the good thing is, Lisa, I can't see any swelling. That's really good. There is no redness. but we have to manage your swelling as well, okay? Just 5 more minutes. It's okay.
Mm-hmm.
All right, okay. So the next step would be, I'm just going to guide you how you can sit up, all right? So now I'd like to understand your condition a bit more better. So you know that you have to strengthen your upper body and do most of the things with your upper body, okay? The good thing is we are moving in a right direction, all right? So the next step would be, whenever you want to get up from the bed, you have to use your elbows, okay? The thing is, just dig your elbow into the bed, all right? And just try to crawl into your elbows.
Like
Yeah.
this?
Yes, like
Yeah.
this. Yeah, can you get up?
Yeah.
Excellent. You've got good tummy muscle. That's good. That's great. Can we do that one more time?
Yes.
If that's okay with you? Yep, slowly lower yourself down. Excellent. And slowly come on to your elbows.
Mm-hmm.
Slowly push, 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 push. And you can
I
sit
can
like that.
feel that activates the muscles. This
Yeah.
is what I want.
So every time whenever you are lying on the bed, and if you feel watching telly or reading a notebook or something, you can actually come onto your elbows. Maybe the remote is there. Incline yourself, prop your bed in up, and just sit nicely.
Yes.
All
But I
right.
just like, even when I go back,
Mm-hmm.
just do a little bit something like this.
Yeah, you can do that. Yeah.
Just to work out, because I was very active and I was doing it all beforehand, so I'm just so bored sometimes. So.
Yeah. Well, I think so. If you're just going to pace yourself, because you did mention that you get tired very easily. So instead of doing all the exercises in 1 hour, just pace it up. Maybe you can come onto your elbows in the morning,
Yes.
and then in the afternoon when you're there on a wheelchair, you can do some
Yes.
pressing up. I'll just go through that
Okay,
again, all right?
okay.
So this is the right way. Now, sometimes you feel that you have to come onto your left side or right side after sleeping. So I'll teach you one more method how you can roll effectively on one side.
Yes.
All right? Are you right-handed or left-handed?
I'm right-handed.
Right-handed, okay. So let's do it on the left side first, okay?
Yes.
So the thing is, you need to hook your leg, all right? Maybe someone can help you at this stage. You can clasp your hand.
Oh, I could, sorry for that, but I could just like hook my leg on my own.
Oh yes, you can do that. Yeah,
It's heavy, but I
That's
could
good.
do it, yeah.
yeah, that's good. Okay, and you can clasp your hand. All right. We'll be doing some cheating, so we'll get some momentum. Okay. So move your arm back and forth. Once you feel that you're getting more movement in your upper limb, then once you feel that your body is coming a little bit up from the bed, just move it in one direction. So one, good. How does that feel?
Yeah.
Good. Now
I
can,
assume the bed is a little bit wider.
Yeah.
Huh? Yeah.
and I can see that you're just in the middle of the bed, so
Yes.
that's good.
Yes.
Now can you again go back? Yeah. Momentum. I'll help you a little bit. That's all right. Okay. Maybe we can practice that again in the next session. All right. So now, what I would like you to do is, can you again come up on your elbow?
Yes.
And I can see that this time you just took a second to come up. That's a good thing.
So easy.
Yeah.
Thank you so much.
That's all right. My pleasure. Can I have you to sit on the edge of the bed?
How do I do this?
I'll show you. So like you're sitting up here, you can hold your knee like that, and you can put that on the edge of the bed.
Start with this leg.
Yeah, you can. That's good. That's good. Now, you have to use your hands, lift yourself up and sit nicely. All right, that's a good thing. Good job. All right. I'm just going to do some strengthening exercises at the moment as well. But before we do that, I would like to teach you one more exercise. But initial few days, maybe if you have someone next to you, maybe just standing and just see how you're doing, I would recommend that. All right. So the next exercise would be, sometimes you can sit a bit more closer to the footrest, and you really want to go a bit more further. So what you can do is, again, you can take the help from the head and move towards your right, okay, and then you can come back to the left. So can we do side shifting? All right, I'll be standing there, pushing, excellent. Are you getting tired, Lisa?
It's okay.
All right, that's good.
Yes.
Good. All right. Now I would like you to take few side shifts towards your left. All right, and relax. How do you feel about it? Okay, that's good. So can you tell me what sort of exercises you're doing with the OT?
We were doing some dumbbells exercise. You gave me the stationary bike for my arms.
35 minutes up.
Yeah.
I'll just take 5 more minutes and then I'll wrap up. Okay.
Yeah, like dumbbell exercises,
Okay.
this, and then the stationary bike for my
Right.
arms.
Okay. Right. Okay. Assessor, can you be with Lisa at the moment? I've just got my dumbbells here, so I'll just grab it. All right. Okay. Right. Thank you, Assessor. Okay, Lisa, I can see that you can sit by yourself pretty good. So whenever you're sitting on the bed, try to do this exercise. So this exercise will help you to relieve the pressure from your bum. Okay, and you're getting some redness around that bottom, which is quite common. So whenever you are sitting on a wheelchair, after 30-35 minutes, if you feel, you can push with the armrest and try to lift your hips up and then just down. This is an excellent exercise for your triceps. Okay, just lift it up and down. Excellent.
Sounds
All right. Okay, and you've got good strength in your arms. You can propel your wheelchair, go out in the gym, interact with people if you feel like, and do all the exercises in front of the mirror.
I'll see if I will be ready for that. I might need more time to go outside because, you know, all my family haven't seen me yet in the wheelchair, my friends, and like it's really strange. I'm like feeling like, you know, do you see the lady in a wheelchair?
Well, again, you're sharing all these things with me, and I'm really happy that you're coming, you know, more open to me. But we don't see things like that. So according to all of us, you are a survivor and you're a champ because you're doing so well with the exercises. It's just that sometimes you may or you may not feel low. So it's good that you share your feelings with your doctor. The medications will kick in, but just stay active and stay motivated like the way you are.
Yes.
And have you heard anything about the Paralympics, that the people are playing sports in a wheelchair?
Of course.
So life doesn't stop. Okay, just think about keep on motivating and keep on doing things, and you're doing great according to me. All right. So before I wind up, Lisa, I'll just quickly see again now how long you're gonna take to move from the bedwood to the wheelchair. This time I'm going to time you up. All right, and see how quickly you're doing, and just tell me if you're feeling confident or not. All right. Okay. So no, that's okay. So I'll practice that, and then we'll wind up the session.